Welcome back to You Heard It Here with Dr. Gary. Today, we're going to discuss the newborn hearing screening. Yep, your newborn, their hearing was tested prior to leaving the hospital. I know it's crazy to believe, with all the other tests that they do and everything that goes on, the fact that they deal with hearing as well is just amazing. So let's talk about why we do the testing, how they do the testing, and what happens if your child fails. First of all, thank you for taking a minute to watch this video. I'm Dr. Gary and this is You Heard It Here with Dr. Gary. Please like and subscribe, especially if you want to see more ear-related content. Alright, so let's get into it. First of all, why do we test newborns' hearing? We test their hearing because the earlier we identify children with hearing loss, the sooner we can get them access to amplification and to sound, the better and earlier that brain development in the auditory cortex is going to start. Early access to sound helps with speech development and early education. So, it's really important that they do the screening. So what happens if your child passes the newborn hearing screening? Really not much. I mean, the nurse will probably tell you, little Johnny or Janie or Fred passed the newborn hearing screening, that's great, nothing to worry about. If they fail, you're going to be told you need to either return to the clinic for a reevaluation or you need to go out into a private clinic to have their hearing tested. Schedule this right away. Sooner the better. You know, within a week or two, great way to do it. How do they do the test? They either use an OAE, which is an otoacoustic emission, or an ABR, auditory brainstem response. For the newborn hearing screening, both of these tests are set up not to look for thresholds, so it's either a pass or a fail. And yes, you can pass in one ear and fail in the other ear. You still need to have your hearing checked if you fail in one ear. So again, if they pass, no major action needed. It's all great. If they fail, we want to be retested. So let's say you're sent out into a private clinic. What can you expect? Well, first, they're going to repeat either an OAE or an ABR. The reason they're going to do that is because if they pass the screening this time, everything's good. That's great. They should also do a tympanogram. Make sure that the eardrum is moving properly. And then, of course, they should look in the child's ear. So what are some reasons that your child may have failed the newborn hearing screening, but passed the repeat screening? Well, it may be fluid in the outer ear or ear canal, amniotic fluid after being born. It could be fluid in the middle ear. A lot of young children have fluid in the middle ear space. It could also be occlusion of the ear canal. When they put the probe in the ear canal, they don't get a good seal. Babies' ear canals are really tiny. There's not a lot of room in there. So sometimes the ear canal kind of pinches shut, causes occlusion, and we get a failed screening. If your child fails the second screening, they will likely be referred on for either a sedated or sleep state ABR, in which they're going to look for actual thresholds. Thresholds are the softest sound that they can hear. And again, this is done through an auditory brainstem response and does not require the child's participation. So, all of this testing in a private clinic or when you go back to the hospital can be done while the child's asleep. In fact, as an audiologist, for young children that age, I prefer when they're asleep. I get better test results. Overall, they're quieter. And it makes it easier for us to get good quality readings. The newborn hearing screening is vital. When we identify children with hearing loss younger, we get them amplification younger. The sooner we start to stimulate the auditory cortex, the better their language development and educational outcomes will be. The newborn hearing screening may identify a lot of children as needing to be retested even when there isn't a problem. But I'll take that every day of the week compared to missing children who have hearing loss and not getting them identified till kindergarten, first or second grade. Make sure if your child failed the newborn hearing screening, you get them in to see a hearing healthcare provider as soon as possible. Get them retested. It's really important that you keep a level head, follow through with the advice of your medical professionals. If your child failed the newborn hearing screening, get their hearing tested today. If your child fails a school screening, get them in to see a hearing healthcare provider. If your parents or grandparents have hearing loss, make sure you're testing your hearing. Hearing can be genetic.
Thank you for watching Hear Well, Live Well. Please like and subscribe. We'll see you in the next video.